Yes, thank you very much for reaching out to Hume and Human Metrics Lab. My name is Natalia Olszewska and I'm a lab lead. We are a science-informed architecture and urban design studio created by architect Itai Palti. Myself, I'm not an architect. I've got background in medicine, neuroscience applied to architecture. So in this very short talk, I don't think I'm going to exploit the topic, complex topic at the same time. I think still, as previous speakers were saying, a topic which we don't have a lot of evidence for. So in the first part of my presentation, I'm going to explain how we work. I think we are slightly different from majority of architectural studios because we create science-informed design. What does it mean? That means that all the projects are backed up by Human Metrics Lab within Hume, and Human Metrics Lab takes inspiration from behavioral science and neuroscience, and we create insights for design process. We think that design process is about decision making, so we take a great deal of inspiration from this man. For those of you who are not familiar with Daniel Kahneman, he's experimental psychologist, and he studied in depth the nature of human decision making processes, and he observed that our decision-making process is impeded by all sorts of simplistic associations and perceptual shortcuts. So, so this is one of the reasons we think that science can help in design process. Science cannot design, but it can inform our decisions. It can also help us to shift traditional metrics, design metrics, from efficient to effective. So rather than looking at kilowatts per hour, we could look at, for example, human performance in space or some aspects of human well-being. And the third aspect of our interest in science is the fact that science can also give us a better understanding of who we are, where we were, and where we're heading from an evolutionary point of view. Now, we all know that our interactions with the environment are extremely complex. So in order to deal with this complexity, we simplify, hopefully not more than necessary. And there are three aspects of our methodology that I just want to discuss briefly. So at the beginning of every project, we create something which we call user experience space formula. Then when we look at effectiveness of our insights for design, we focus on correlation rather than causality. And I think the third very important aspect of what we do is the fact that we start every design project with a choice of human metric. So human metric is a reflection of impact of design on human experience, and it could be related to individual experience, group, organization, and society. And this is just to stress the fact that really the choice of human impact is critical because it's going to shape the design outcome. So on left, we can see the traditional school where human metric was performance of students on tests, measurement of test scores. On right, we can see a progressive school where creative thinking becomes human metric. And such human metric could be, for example, also social cohesion or sense of belonging. And I'm going to speak about it shortly. So we end up with formulating these theses. We end up at the very beginning of our research project with finding the right human metric for the project, and then we start a literature review. Now, the intersection of built environment and mental health. So I think architects intuitively understand the impact of, or the relationship between architecture and mental life. I like this expression of architect Professor Petaya, who says that architecture is constructed mental space, and in his native language Finnish, it means that architecture is a materialized expression of creator's mental space, that is architect, but our mental space, that is mental space of users, is also structured by architecture and experience that it gives to us. At the same time, I fear that architects and also developers don't fully recognize the potential of architecture to shape our mental health and health. But I think also the understanding of public health is expanding. And recently, when we were talking about public health, we were thinking only about clinics and hospitals and access to healthcare. Then we started to be more and more interested in nutrition. And now we start maybe also recognizing that built environment is part of our health and can shape our health and mental also well-being. So I would repeat after Dr. Oni, urban epidemiologist, which I met a couple of years ago during one of the conferences, that architects and urban designers are becoming healthcare professionals. So we design for social connection. Not necessarily all our projects are focused on social connections, but very often we implement this metric in our projects. As it was stressed before, I think we all recognize the fact that humans are social creatures, and the quality of our life is constructed around quality of our bonds with others. So to discuss very briefly and superficially these ideas for design for social connection, I'm going to use again an aspect of our methodology, that is user experience space formula. So I think it's crucial to understand the user, who we build the environment for. People are diverse. They have very different needs, and also loneliness is not always perceived in the same way. There's a lot of people who have a lot of interactions, but they feel lonely, and there are people who have very few interactions and they don't necessarily perceive loneliness. When we design for experience to combat loneliness, we design for some experiences like safety, trust, engagement, and sense of belonging. And some of the spatial metrics or aspects of space which would support this kind of experience could be light, some aspects of topology like prospect, refuge, access, designing with human scale in mind, and landmarks and shared symbols which help to create some sort of cultural identity and strengthen also sense of belonging.
One minute, please. Thanks.
Okay. So here are different typologies that we could design with this idea of social cohesion or social connection: house, public space, workplace. I don't have time to get into details. Some examples of projects we've done so far. So this is a project we've done for Association of Children's Museums. The stress was on experience of children, but also families, and strengthening the bonds within families. And this is an example of guidelines that we've created that was interactive exhibit for families as a user, and the experience was about collaborative learning. This is another project in San Diego, which is the most lonely city in the United States. We are creating some interventions at train stations. You can see, for example, seating arrangement, interactive design, or some elements of play. And this is also another concept for the same project in San Diego, a lab next to train station, which was called Green Fingers, where travelers who enjoy the idea of growing and nurturing a plant could meet together while waiting for train. So just the closing slide, I've been talking about science. We also recognize, even though we are a science-informed design studio, we recognize the fact that science is just a tool, and it's a way of making our experience of architecture objective. But there are different aspects of our experience which are archetypical, collective, subjective. And I like this phrase of ephemeral, I would say. Gaston Bachelard, who started as scientist but ended up as philosopher, who was saying that house should shelter daydreaming, and the house should protect the dreamer. The house is one of the greatest powers of integration for the thoughts, memories, and dreams of mankind. And I wish we start understanding better the potential of built environment in shaping our mental space and mental health. Thank you very much.